I'm going to talk to you a little bit more about joint stiffness. Joint stiffness is pretty broad of an issue, but it affects a lot of people. So I'm going to go over exactly what could be the causes of it, how do you know you have it, and how it affects you, and how therapy can help you with joint stiffness. So first of all, what exactly constitutes joint stiffness and why does it occur? So joint stiffness pretty much is a broad lack of flexibility in a joint. You have trouble moving through any kind of motion smoothly. It feels very tight, maybe achy. It could be a result of something like arthritis, which is pretty common. Joint stiffness is a very big symptom of arthritis. So what kind of constitutes joint stiffness? It could be a decrease in your joint space, either a thinning of a cartilage around a bone. It could be a decreased height of a meniscus in per se like your knee. It could be decreased disc space in your spine, and it could be decrease or degeneration of your labrum in your hip or your shoulder. So when there's decreased joint space and there's not any of that cushioning that I just discussed with you, the bones kind of get closer together and they may rub, and that may cause some stiffness, amongst other things, crepitus, which is that funky noise you might hear in a joint. That doesn't necessarily mean it's painful, but you can hear it, an auditory kind of popping. Sometimes there's an increased fluid in the space. It could be just due to inflammation in the joint space. Some people even have it post-surgery, like if you're coming to therapy and you're after a surgery like a knee replacement or a hip replacement, there's active inflammation, which isn't necessarily a bad thing. It's a good thing, but the problem is with all that swelling in there, the joint is kind of tighter, so it's harder to move throughout a certain range of motion. And as the swelling goes down, then the stiffness kind of relieves itself a little bit, and then you're able to move a little bit better. So arthritis is pretty broad. There's kind of two main types of arthritis. There's osteoarthritis, which is more the musculoskeletal condition that most people talk about, and that's actually degeneration of the joint. So that cartilage between your upper leg bone and your lower leg bone kind of thins out, and as that thins out, sometimes there's increased bony growth in that space, and that pinches into the space, which can cause that stiffness. And then there's also rheumatoid arthritis, or RA, and that's more of a systemic inflammatory process, and that involves a little bit more with some certain medications that you might need to go to, and especially at a rheumatologist, versus with OA you're more likely going to see an orthopedist. How does it present itself? So pretty much, people will complain of various different levels of issues. One big one is going up and down stairs, so either going up or down doesn't really matter. They might need to use a handrail a little bit more than normal because they just feel like it's so hard to bring that leg up or to bring the leg down because it's not moving as smoothly. Getting up in and out of a chair is a big one, especially if the surface is lower than your normal chair. So for instance, like a couch at home, and you go to get up and you just get up really, really slowly because it's really hard to move the joint, especially those knees or your hips, or your back for that matter. And being in a position for a really long period of time, as well as just the act of sitting, but just sitting for a long period of time, there's less fluid movement in the joint and less lubrication. So when you go to get up, because there's less lubrication, it's very stiff. Other things are the time of day your stiffness occurs and how long it lasts. So for instance, is your stiffness just pretty much when you get up in the morning and it's stiff for like maybe 10 to 15 minutes before you get moving a little bit better, and then your movement kind of increases it, and that's because of that fluidity that goes into that joint. And as you're moving around better, there's more mobility in the joint. That's more likely like an osteoarthritis type of symptom. Small joints, so if you notice more in your hands or your fingers or your wrist, you notice them there first, and it's usually both sides, and then it progresses to more bigger joints, and it's both sides. That would be more likely like a rheumatoid arthritis because it's systemic, so it's not going to pick one side versus the other like osteoarthritis. It's more global, so it's multiple joints, starts small and then progressively goes to the bigger joints. If you notice any warmth or redness, so just to the touch, your knee or your elbow or your wrist just kind of feels like a little warm and maybe a little bit red, and that's just due to the inflammation. Usually things like ice and anti-inflammatories will help with that. It just depends on how often it occurs. If it's just very random, then that self-treatment is pretty good. But if it's more on a frequent basis, then you would want to seek out some professional help to help you with that. So self-assessment, what can you do or notice during the day that would give you the idea that maybe you have some joint stiffness that you might need to be aware of? So first thing is, like I said, feeling tight in general, slow to move. It takes a little bit of time to get moving in the morning is a big one. Increased difficulty with your normal daily activities. No matter what age you are, if you have trouble getting in a bed, trouble getting out of a chair, going up and down stairs, that's a pretty big deal for most people. So if you notice that that's getting significantly more troublesome for you, then that's something you should take note of. Another thing, like I said before, is it in one joint or is it in multiple joints? It could be multiple joints on one side of your body, or it could be even multiple joints throughout your body, upper, in your arms or your legs. So take note of that as well. The redness and swelling. Make sure you kind of take an idea of, is it happening more frequently now over time? Is it just random? Is it not as frequent as you think? And then it's more manageable that way. Take kind of note of how often your joint actually feels like that. I talked about stairs, transfers, getting out of bed, getting up and down of a chair I talked about. And whether your stiffness improves pretty quickly or lasts over hours. So that's a big deal. So does it get better after 10 to 15 minutes, or does it last for hours? And if it lasts for hours, that's something you would want to be more cognizant over. So how physical therapy can help. How can we do that for you? So what can we do? So we can determine the root cause. So even if we see patients who haven't seen a physician, we're highly trained to be able to determine if it's something that we can take care of for you. So the stiffness, is it because of arthritis, do we think? We can do specific tests and measures to determine that in the office without a problem. We can tell you if it's something you need to really be worried about, and if it is kind of maybe an RA, we can then refer you to the doctor if you're not sure. We can always take a look at that for you. So is it musculoskeletal, or is it something more systemic that we would say, hey, maybe you should get some blood work done? We could definitely help you with that. We would give you individualized exercise program. We don't treat everybody the same. Nobody is cookie cutter treatment here. We would look at you, assess where your issues are at, whether it's range of motion only, range of motion and strength, and all those things then we incorporate exercises for, so we can do that for you. The biggest thing is the manual treatment. You can't really do that to yourself at home, so we can assess what kinds of things hands-on that we need to address, whether it's helping with the swelling, which we do some retrograde massage for, modalities such as ice and or heat, depending on how you're presenting. Joint mobility, so that means we're moving the joint in a specific way to increase a specific motion, and also just soft tissue work on some of the muscles, because sometimes even though the joint's stiff, your muscles around the joint kind of get overworked, and we kind of need to address that as well. The biggest thing is the education that you receive when you see a physical therapist. We spend a lot of time with you, and we go over the root causes. We describe the anatomy in ways that you can understand, so that you can understand the problem. We can help you prevent the problem from getting worse. We can improve that joint stability. We can give you the proper progression of exercises so that you don't feel like, oh, I'll just go to a gym. Well, if you go to a gym, you're just kind of like standing there, I don't know what to do, which machines to do. And the other thing is, if you're doing too much at the gym, that could then set you back. So at least we'll be able to give you proper exercises, train you on those machines, and then give you that detailed home exercise program. And the biggest thing is the patient's goal. So what do you want to return to? Whether you're younger and you play sports, or you're older and you just want to be able to walk around your house or walk down the street to get your mail out of the mailbox. Those are really important things. Why do you want to do therapy? What can we help you with? That is very important to us. So we can help you with those things and get you back to doing those things relatively quickly. And it's conservative, and it doesn't require any medication. So that's pretty important, because usually you want to start out something like that and not necessarily go the medication route first all the time. So if you'd like some more information about joint stiffness, or you think you may have an issue with joint stiffness and it's getting worse, just go to the office for more information or click the link below.